Thank you so much, Layla. I appreciate it. Good morning, everyone. As Layla mentioned, my name is Maria Evans. I lead the Community Impact Team at Fannie Mae. I'm really delighted to be here to welcome you to today's event. This is the first time that Fannie Mae is sponsoring Skills for City, and we're really excited to partner with Common Impact and to be a premier sponsor this year. As Layla mentioned, the theme is Pathways to Healthy Cities, which aims to empower nonprofit organizations that focus on addressing social determinants of health. And really, the goal is about eliminating disparities and fostering the development of healthy and equitable communities. So, for those of you who may not know, Fannie Mae is in the secondary mortgage market. And so you might be asking, why are we interested in sponsoring an event that focuses on health? When we think about it, housing is a key social determinant of health. It's very difficult, if not impossible, to have good health outcomes and to stay healthy if you're not stably and affordably housed. It's difficult to stay healthy if your housing itself is not healthy. Think about the indoor air quality. If it is low due to poor ventilation, maybe the windows where you live are painted shut, or maybe it's unsafe in your neighborhood, in your community to open the windows. Or maybe the materials, such as the countertops or the cabinetry, off gas. They emit toxic gases that are not good for your family to breathe. Or maybe you have carpeting that traps in water that contributes to mold or other pests infesting your home. Um, it's difficult to remain healthy in those circumstances. It's also difficult to remain healthy if your housing is overcrowded. But maybe because of cost reasons, you need to double or triple up with other people, other families, other relatives to bring your overall housing costs down. Layla mentioned the pandemic. Think back to the early days of the pandemic when hospitals were getting overcrowded. And the recommendation from the CDC was for us to quarantine at home, to isolate at home. That's very difficult to do if you've got several adults and several children living in a small space. And so it would be difficult in any of those circumstances for you and your family to stay healthy. But families across the US face all of these challenges, particularly if they live in communities that have been overlooked, disinvested in, cut off from resources for decades. And so, for all of those reasons and many more, Fannie Mae is actually a really good partner to support an event like this, one that highlights the important intersection of housing and health, because we know from our experience, from our expertise, that safe and secure housing is one of the most important social determinants of good health outcomes. And we also know from our collective experience that this is an equity issue, no doubt about it. So today, I know there are about 20 employees from Fannie Mae who are volunteering their time and talents, and I want to thank them. I'm really looking forward to hearing the different ways that you are able to bring your expertise to bear, to share your knowledge, to share your experience, and contribute and engage today. I'm excited for all of the volunteers across all of the different organizations because I think today is really going to be a great opportunity not only to support the nonprofits who are doing such great work, but for you to build connections, to build that sense of team camaraderie, to maybe develop some skills. Think about your communication or leadership skills. It's also an opportunity to build new relationships, meet new people, and again, have that opportunity to share your expertise and your skills to make a difference. So, thank you all so much for volunteering. Thank you again to Common Impact for creating this great opportunity for all the nonprofits who are also volunteering and spending their time to support us. I wish you all the best of luck, and I look forward to hearing the outputs from today's session. Thank you so much.